Medicare Advantage plans get a lot of attention, and part of that comes from the incessant TV commercials with Joe Namath and JJ Walker and Danny Glover and other celebrities pushing Medicare Advantage plans, but it's also coming through your mailbox and a lot of different places marketing Medicare Advantage plans, and at times they can sound too good to be true. So let's go over everything that you need to know about Medicare Advantage plans. Now we're going to go over the pros and the cons of Medicare Advantage plans, as well as who they work really, really well for and who they may not work so great for. So make sure you stick to the end so that you can understand what types of people tend to gravitate towards Medicare Advantage plans and what types of people tend to gravitate away from Medicare Advantage plans. Now, before we get into the pros and cons, it's important to set the stage a little bit so we understand exactly where Medicare Advantage plans fit and what they are trying to accomplish. Now, remember that original Medicare is made up of Part A and Part B, and this is provided and administered by the federal government. What that means is that if you have a bill for visiting a doctor or a facility, that bill goes to Medicare, a federal program, and then they pay their portion of that bill, and the remaining balance is then sent to you, and they leave significant financial gaps to you. Just for Part B as an example, Medicare will cover 80% of those approved costs, but then you're on the hook for 20% of the remaining balance, and that's unlimited. There is no out-of-pocket maximum on original Medicare, so if you go in and you have a catastrophic event and you get $1 million medical bill, well, you're going to be responsible for $200,000, and most people are not in a financial position to where that's okay. And now this is the purpose of Medicare Advantage plans. They are there to help protect you against that unlimited financial risk that comes from just having original Medicare. So how is this accomplished? Well, private insurance companies agree to take on the risk and the responsibility and the management of those Medicare healthcare decisions away from the federal government, and now the private insurance companies are handling everything. So this means that if you go in and get services and you're covered by a Medicare Advantage plan, that bill, instead of going to the federal government first, is now going to go to that private insurance company, and they're going to handle the billing and the claims and then collecting the payments from you in the form of co-pays, co-insurance, and other things like that. In return, the federal government pays these private insurance companies for them being willing to take on this risk and management of Medicare Advantage plans. And that's a set amount per month for every person that is enrolled in a Medicare Advantage plan with that insurance company. And we can't give you the exact reimbursement amounts because it depends on the company, the geographic region, and they're actually rated with stars or quality ratings for these Advantage plans. And the higher the rating, the more they are reimbursed because the plan is being managed more efficiently. But it's important to understand this financial incentive, right? Because Medicare Advantage plans, or at least the companies that offer them, are getting funds from the federal government to offer them. And this leads us to our pros and cons of Medicare Advantage plans. We're going to start with pros, and then we're going to end with cons. And again, we're going to wrap up with who these plans work really well for. So probably the biggest pro of Medicare Advantage plans are tied to that financial conversation. Because the private insurance companies are getting those payments, the biggest pro to Medicare Advantage plans are really, really low monthly premiums, and sometimes zero. In fact, the Kaiser Family Foundation puts that 65% of all Medicare beneficiaries on a Medicare Advantage plan enjoy $0 premiums. No premiums for health insurance. That's an unbelievable deal, and that is a huge lure into why people choose Medicare Advantage plans. Now, another 20% are paying less than $50 a month for their Medicare Advantage plans. So that puts us at 85% of all Medicare beneficiaries on Medicare Advantage plans are paying less than $50 a month for healthcare premiums. That's a big deal. The next pro to Medicare Advantage plans would be that there are out-of-pocket maximums. Remember that the purpose of Medicare Advantage plans is to protect you against that unlimited financial risk. And the other good part around the out-of-pocket maximums is that those are regulated by the federal government. So the companies that offer Medicare Advantage plans are restricted in how high they can make those out-of-pocket maximums. Now, at least in our area, those out-of-pocket maximums range from $4,500 a year to $7,550, and the average is somewhere in the $5,000 to $6,000 range. Remember, those are out-of-pocket maximum. That is the maximum amount that you would spend in a year towards your medical costs as long as they are within the plan and covered by the plan. It's not a deductible. It is the total cost that you would pay. So that's a big perk. I mean, that's a big advantage to having something that protects you against those high costs. It's a lot like what you're used to through if you're on a work plan or an individual plan. The other thing to think about with those maximum out-of-pocket costs is typically around 3% of beneficiaries actually hit them, with the average being around $600 a year in the form of cost sharing. So yes, those out-of-pocket maximum numbers may seem high in terms of $4,500 up to $7,550, but only 3% of beneficiaries are really hitting that. Again, the average is going to be around $600 per year, but it's something to keep in mind because we're talking about total financial risk. In the event that something bad happens that year, you have high costs, you are limited on how much it's going to cost you, which is a good thing. Another big pro to Medicare Advantage plans would be that they most often come with Part D prescription drug coverage included. If you do not go the Medicare Advantage plan route, whether you're just using original Medicare or you're doing original Medicare with a supplement plan, you would have to purchase a Part D plan separately. And in 2022, the average monthly premium for Part D plans is $33 per month. Well, on a Medicare Advantage plan, it's included in that $0 premium or very low premiums. So that's a great perk and a great benefit to have when it comes to Medicare Advantage plans. Moving on, the fourth pro to Medicare Advantage plan would be the other perks that come with these plans. We mentioned the Part D plan that is already included in your Medicare Advantage plan. Well, they also typically include dental coverage, vision coverage, hearing aid coverage of some sort, gym membership reimbursement, meals when you've been released from the hospital, transportation to and from hospital visits. They also have something called an OTC benefit, an over-the-counter benefit, where you get dollars every month or every quarter that can go to purchase medical supplies for you. So a lot of other perks are thrown into these Medicare Advantage plans, which make them really enticing. And these are the things that you're going to hear on all of those commercials, right? It's going to be free this and free that and all kinds of extra benefits that are coming because, again, they're receiving those funds from the federal government and they want to throw in extra benefits to lure people into signing up for Medicare Advantage plans. Now, with these perks, they aren't universal, meaning they aren't the same for every different company. They're all different depending on the insurance company that you choose and that they're offering. And the good news is that all of these companies are kind of competing against each other. So generally, they're pretty similar, but they're always trying to outdo each other in certain ways. So again, that they can get people to come sign up on their plans. So the other perks are a huge benefit of Medicare Advantage plans. An important note here with not only prescription drug coverage, but all of the other perks that come with Medicare Advantage plan and that managed care aspect of it is that all of these extra benefits are managed by that insurance company, right? So we talked about prescription drug coverage, dental, vision, any of those other ancillary benefits. Those are all managed by that same insurance company, right? We already talked about the medical side of things of having some sort of prior authorization, but that also applies to the other benefits. So your Part D prescription drug coverage, the tier that your drug is on, the co-payment and the formularies that are going to be available to you with that drug plan are all managed by that same insurance company. You're kind of tied to that company. You can't pick and choose a plan that you would like. Same with dental and vision coverage. You're tied to that company, their customer service, their policies, their procedures. You contrast that with if you were to go to the supplement plan route, you could pick and choose your prescription drug plan. You could pick and choose your dental plan. You could pick and choose your vision plan. So that's something to keep in mind when it comes to the managed care aspect of Medicare Advantage plans. The fifth pro of Medicare Advantage plans would be kind of connected to the last two that we've talked about, and that would be convenience. With a Medicare Advantage plan, because you're no longer using Medicare Parts A and B, although you do still have to have and be enrolled in Medicare Parts A and B, you don't need to carry around your Medicare card. You can put that somewhere else, put it in a safe place. Do not get rid of it, but put it in a safe place. You don't have to carry it on your person anymore. You just have one card that is from the Medicare Advantage company. This means that anytime you go into a doctor or a facility or a pharmacy, you just need to present the one card. You don't need to carry with you your original Medicare card, your Medicare supplement plan card, your Part D prescription drug card, your dental insurance card, your vision insurance card, your Costco card. You don't have to carry, well, you still need to carry your Costco card, but you don't need to carry all of those other cards that you would have to do if you were to go the Medicare supplement route, Part D route on its own, and the other ancillary benefits is what we call them with dental, vision, and others. So it's very convenient to just have it all in one card to keep track of, and you don't have to worry about all the others. Finally, the last pro that we're going to talk about with Medicare Advantage plans is Part B reimbursements. Now, it's important to note that this is not applicable for all Medicare Advantage plans. It's only with specific Medicare Advantage plans in specific zip codes and certain situations. But if you fall into those situations, there are Advantage plans that offer a Part B reimbursement. Now that dollar amount is going to depend. It's usually lower. It's not going to be your full Part B premium amount, but it is going to be some amount that is going to be that they offer back to you for signing up on this Medicare Advantage plan, whether that's $10 a month, $35 a month, $45 a month, whatever that may be. Now there are some plans, and this is important because of all those commercials that go on there. Oh, I got my full Part B reimbursement. There are some plans that offer that, but let me tell you what they are. They are usually for those who are veterans and have VA coverage, or they're for those who are low income and on Medicaid, so dual eligible with Medicaid and Medicare. But for the traditional average person, I wouldn't expect to get full Part B reimbursements from your Medicare Advantage plan unless you fall into those two categories. So when you're seeing all these commercials, they're trying to get you to call in and, oh, I'm on an Advantage plan, but I'm not getting my Part B reimbursement all the way. They're trying to get you to call in for that big carrot that's sitting there with free Part B coverage. That's just not how it works in most cases. So that wraps up the 6 major pros of Medicare Advantage plans. So remember that it's going to be low premiums, a reasonable out-of-pocket maximum. It's going to include a prescription drug program. It's going to include other perks. It's going to be convenient in terms of not having a lot of cards to worry about. And then there are some Part B reimbursements in certain areas under certain situations. So right now it's sounding like, goodness, these are great. Why would anybody choose something differently? And it's important to understand that with each of those pros, there's kind of a yin and a yang here. There's going to be a con that's associated with it for some reason. So let's go over the cons of Medicare Advantage plans. The first one is going to be connected with the first pro of Medicare Advantage plans. So remember that first pro of Medicare Advantage plans is 0 or really low premiums. Well, what comes with that is cost sharing. And again, this is something that you're used to from your employer plan or your individual plan before you came onto Medicare. Cost sharing is going to be things like a copay, co-insurance, out-of-pocket maximum, things like that where your dollars are going to pay for services. And this becomes a con because for pretty much every service that you're going to have some form of a copay. So if you go see your primary care provider, it could be a $10 copay. If you go see a specialist, it could be a $50 copay. This all depends on your insurance company and the Advantage plan that you choose. It's not universal around all the plans. It's going to be different depending on the plan you choose, but you're always going to have some sort of a copay and co-insurance. So think about that. If you go into your primary care provider and they say, you know what, we need to do some blood work and an MRI, and you go do that, and then you know what, you probably need to see a specialist and eventually need surgery. Well, every step along the way with that, you're going to have a copay. You're going to have the copay to see the primary care provider. You're going to have the copay for the blood work and for the MRI. You're going to have a copay to visit the specialist, and then you're going to have a copay or co-insurance on the actual surgery. So each step of the way, if people are uncomfortable with those copays or co-insurance, that's something that comes to mind. Because the alternative with supplement plans, if specifically with a Plan G, is you're going to have the deductible of the Part B deductible amount. And then after that, you don't have to worry about costs. They're just coming with higher premiums. So copays, co-insurance, cost sharing up to the out-of-pocket max is one of the cons to Medicare Advantage plans, which leads into the second con of Medicare Advantage plans, and that is the total financial risk to you is higher if you have a bad year or bad years than it would be on a Medicare supplement plan. And we have another video that breaks this down by the numbers, but essentially you take your premium cost per month, multiply it by 12, and then add on your out-of-pocket maximum and or deductibles, and you're sitting in between the $4,000 and $5,000 range with Medicare supplement plans. You contrast that with Medicare Advantage plans, and your total risk is going to be your premiums, which could be $0 or very low, but it's also going to include that out-of-pocket maximum, which could range from $4,500 up to $7,550. So the total risk with Medicare Advantage plans is generally a little bit higher if you have a bad year or a catastrophic year or you have chronic conditions year over year. The third con to Medicare Advantage plans would be that it is managed care. Now we say this as a con because it's handled a little bit differently than just original Medicare. Original Medicare has its stipulations and it has the things that it will and won't cover, but in general, you're going to have fewer hoops to jump through when it comes to prior authorizations or approvals for certain procedures. If it's covered by Medicare, original Medicare is going to cover it. Now, Medicare Advantage plans agree to cover everything that Medicare covers, but they don't agree to cover it in the same way. So they might ask for a prior authorization. You might go into a doctor who might say, hey, we need to move on to do this study or blood work or MRI or test. And the Medicare Advantage plan may come back and say, you know what, we need a pre-authorization or we need you to do something else first before that happens. And so there can be hoops to jump through. and things to worry about with Medicare Advantage plans because it's being managed by that insurance company. They have more of a say in your healthcare decisions than you would otherwise experience with the original Medicare. So wherever you stand on the spectrum of whether managed care is good or bad, it's important to know that that's how Medicare Advantage plans work. It's also important to know that that's how the plans that you've been on have worked as well. If you've been on a group plan, you've had to be in a managed care plan where you might have prior authorizations just the same. Just know that there's a little bit more flexibility and freedom going with a Medicare supplement plan on original Medicare than with Medicare Advantage plans. The fourth is another major con to Medicare Advantage plans, and that would be networks. Again, let me repeat this. This is what you're used to on your other plans. You're used to a network and going to in-network providers. But with Medicare Advantage plans, it is tied to a geographic area of coverage. Sometimes that is by zip code or county. Sometimes it's several counties. Sometimes it's an entire state, depending on where you're at. But you are confined to networks with Medicare Advantage plans. You contrast that with a supplement plan where you don't have a network. Any provider or facility that participates with Medicare, you can go visit them. It doesn't have to be in your home state, doesn't have to be anywhere in particular. But with Medicare Advantage plans, you're tied to a network. That means if you go outside of your geographic area, or let's say that you live in one place for part of the year and you move or go to another place for another part of the year, where you're going to have to switch Medicare Advantage plans because they only apply within their coverage areas. If you go out of network, you're going to have higher costs. And there are two network options that you really have access to with Medicare Advantage plans. One is an HMO or health maintenance organization, and the other is a PPO or a preferred provider organization. And what that means is an HMO is a little bit more restricted, a little bit of a smaller network. And if you go out of an HMO network and visit a provider outside the network in general, you're going to be responsible for all of the costs. Contrast that with a PPO network. It's a little bit larger of a network, and then it does have out-of-network benefits. So if you do go out of network, yes, it will be more expensive for you, but you're not responsible for 100% of the cost, like is what is typical with an HMO. It's important to note here that if you are outside of your coverage area and you do go out of network because it is an emergency, typically Medicare Advantage plans have emergency coverage in those plans that treat it like it's in network. Again, that's going to depend on the plan, but there are typically emergency situations where you are covered if you are traveling in the United States, as an example, outside of the state and an emergency happens. The other note that I want to make here in networks is that doctors can drop from the network mid-year. So you could be going to a doctor or a provider or a facility like a skilled nursing facility or anything like that, and mid-year, that provider could drop from the network, and now you're stuck having to find a different facility, right? Find a different place for home health coverage or whatever that may be. So that can be a pretty significant con if you're on an Advantage plan and that network starts to shift with providers. A final note on the network side of things is that out-of-pocket maximum that we talked about in the pro side of Medicare Advantage plans, those numbers that I gave you are for in-network costs. So if you stay in network, your out-of-pocket maximum is going to range between $4,500 and $7,550. As soon as you go outside of the network, that out-of-pocket maximum changes and it goes up. Now, in our experience, most people, if it's a planned event, they aren't planning on going for services outside of their network. They're able to plan and know who their doctors are. And that's why you'd want to work with a good agent. Your agent can look up those providers. Even if those providers aren't showing up on a provider search, they may still be in that network. So work with your agent. They can search providers for you, make sure that you're staying in network. But just as those numbers that we're talking about in the out-of-pocket maximum, they can be higher if you're going outside of network. Finally, the last con that we're going to talk about with Medicare Advantage plans would be if you change your mind and you decide to move. Now, once you go on a Medicare Advantage plan, you have a year before you are kind of locked into that decision. And here's what I mean by that. As we mentioned, your total risk can be higher with Medicare Advantage plans. So if you know that you have upcoming medical expenses that are going to be very high, and let's say that it's a chronic condition, so it's going to be for a long time, and you're on a Medicare Advantage plan for at least a year, and you want to switch and go to a Medicare supplement plan, well, you can try, but if you want to switch like that, the carriers or the companies that offer Medicare supplement plans are going to ask you health questions, and you're going to be medically underwritten. What that means is that they're going to ask those questions, they could get some sort of a recommendation from your doctors, and then they could deny you coverage. So they could say, you know what, no, that risk is too high, you do not qualify for a Medicare supplement plan. Had you chosen to enroll in a supplement plan when you first became eligible, they don't ask those questions. It's called guaranteed issue. You're automatically in for a supplement plan. But if you choose an Advantage plan first because everything is going great, and then something happens and you decide you want to switch later after a year of being on an Advantage plan, it's just not easy to switch like that. Now, if you're healthy and there are no problems and you would like to switch over to a supplement plan, again, you're still going to have to go through underwriting, but you could still get approved. But again, the main reason why people are wanting to switch from an Advantage plan to a supplement plan is because something is going wrong and they want the additional coverage that comes with supplement plans. That wraps up our list of pros and cons with Medicare Advantage plans, but let's go over really quickly who tends to gravitate towards Medicare Advantage plans, or who do they work really well for, and who tends to move more away from them and towards something like a supplement plan. And there are three things that we really need to talk about here. One is going to be your health, the other is going to be your wealth, and the last one is going to be your risk tolerance. So keep those in mind as we go through this. So people who tend to gravitate towards Medicare Advantage plans, let's talk about those three categories. Health. In general, they are healthier or lower utilizers of the healthcare system. In general, they have lower healthcare costs. They don't have expensive chronic conditions, because if they do, they would be better off with a supplement plan. If you're generally healthy and you don't have high-cost medical expenses every year, and you're in good health and you don't make visits, then you're going to save money by having low or no premiums with your Advantage plans, and you can put that money away and set it aside in the event that you have a bad year, and then you can take care of that year with your funds that you've got saved up. That kind of helps move us into that wealth conversation now, is that if you have enough wealth to cover catastrophic events with that out-of-pocket maximum, and so you're okay just saving the money from your low premiums, that's one scenario. If you have wealth in the forms of an HSA or other funds that have been saved up for medical expenses, that's one person who might gravitate towards a Medicare Advantage plan because they have the funds available in the event that they have a bad year or two. The other side of the wealth conversation is that if you don't have the funds from a retirement perspective to be able to afford the more expensive fixed cost premiums of supplement plans. Supplement plans are going to run you between $120 to $200, at least in our area, per person per month. And those amounts go up every single year. So those are fixed costs you have to worry about. If you don't have the funds, or you don't feel comfortable with having such high fixed costs, knowing that you might not use those benefits for a few years, those people tend to gravitate towards Medicare Advantage plans. And this is all related to risk tolerance as well, right? So if you are okay taking the risk that you're going to have several good years, but you might have a bad year or two or several, and you're prepared financially for all of this, that's a risk tolerance that you got to manage. And then finally, the other people who are a little bit more prone to go towards Medicare Advantage plans are those who don't plan on traveling outside of their coverage area very frequently. And trust me, I know how this goes with a lot of my family members. They think, okay, we're going to retire, and that's when we're going to travel the world and see new things and go different places. And then they end up not doing that. They stay in their coverage area most of the time. They aren't going outside of their coverage area. So it's okay to have that network to where they're planning on seeing their providers. I mean, think about this. How often are you seeing providers outside of your state or outside of your county? Similar thing here. If you're on an Advantage plan and you're going to stay inside your county or state as long as it's in that network, then the people who know that that's where they're going to be are okay with Medicare Advantage plans. Now let's talk about who tends to avoid Medicare Advantage plans. And again, we're going to go over your health, your wealth, and your risk tolerance. So in terms of health, in general, people who are unhealthy or have medical problems tend to gravitate away from Medicare Advantage plans and towards supplement plans. If you have chronic conditions, and this can be any number of conditions, if you have diabetes, heart disease, or you have any sort of cancers, or you have family histories of high medical costs, and you're worried about those chronic conditions and the costs that come with them, Medicare Advantage plans are going to have higher out-of-pocket maximums when it comes to that and higher financial risk to you. Let's go to that second part of the conversation, which is around wealth. If people have the wealth to afford Medicare supplement plan premiums, which again are going to range between $120 to $200 per month in our area at least, then those people a lot of times want to have the security of a Medicare supplement plan. And this also goes to risk tolerance. The type of people that go away from Medicare Advantage plans are the type of people that want to lay down on their pillow at night and not worry about health insurance. They're getting the richest benefits with a Medicare supplement plan and original Medicare. It's coming at a much higher premium, but they don't want to think about it. They don't want to worry about a network. They don't want to worry about prior authorizations or anything like that. And they can afford the cost of Medicare supplement plans. Those people tend to avoid the Medicare Advantage plan. Somebody who travels a lot and they're going outside of their area quite often. Again, if you're living in different parts of the country at different times of the year, a supplement plan, you don't have to worry about networks. You don't have to worry about staying within your geographic area to get the coverage that you want. Finally, people tend to avoid Medicare Advantage plans if they don't want to have to worry about jumping through the hoops that come with the managed care aspect of those plans. And what I mean by that is the prior authorizations, the prior certifications, potentially being denied coverage in certain areas or certain instances because the Medicare Advantage insurance company wants them to do other things first. So again, the people who tend to avoid Medicare Advantage plans are the ones who just want the security of knowing they can set it and forget it. They don't have to worry about their plans. They're okay paying money and extra premiums, even if they don't use the benefit, and they would prefer the Medicare supplement plan. So you made it. There's the final rundown of everything related to Medicare Advantage plans. Now, there are always exceptions, and if you have questions around that, don't hesitate to reach out to us. Remember to subscribe to this channel because we constantly put out more information and more videos around Medicare, Social Security, long-term care, and estate planning. So make sure you hit the subscribe button, give this video a like. Please don't hesitate to reach out to us in the comments. We do read them, we answer them when they're appropriate, and we're more than happy to help you, or feel free to reach out to your agent if you have questions around Medicare Advantage plans. As always, we appreciate you and thank you for watching.